Now here we can see that if you are operating, supposing on the area which is closer to the knee or the lower thigh, the technique basically remains the same. Only thing is, in the previous video, you have seen that we have isolated only the foot and ankle. In this particular case, because your operating field is either knee or the distal thigh, you don't want the rest of the leg to be left open. So you completely drape it inside and cover the leg and see that only the operating field is left open. So this is again a short video of the same procedure. But again, as I said, here you are probably going to do it on the knee or the thigh. So there you go. So here, instead of a mop, you have taken a big sheet and you have covered the foot, ankle, and the lower third of the leg in the sheet, which you will secure in place with either a clean wrap or a roller bandage, depending on the availability. So here you can see that the knee and the upper third of leg. So this type of draping would be useful in any surgery on the knee or on the upper end of tibia, where you don't really need to keep the ankle, foot, and the lower third of the leg exposed. So you secure it with a bandage.
Yes, so you're done.
Yes. Okay. Thank you. So this basically is about the part of the lower limb from the mid thigh to the ankle and foot.